Okay, in this video we're going to talk about obtaining a pulse oximetry or oxygen saturation level on a patient. Most vital signs will include an oxygen saturation or a pulse oximetry. And to do that we're going to use a pulse oximetry device, looks like this, to get our numbers. This is an electronic device. And I just want to say from the very beginning that as with any other electronic device, you have to be very careful to use it properly or the numbers you get may not be accurate. This particular device works by it works almost like a laundry clip. So you just sort of press it there, it'll open up, and the patient is instructed to stick their finger all the way in, and then you let off on the clip. There's a little button that would be your on and off button, so you go ahead and hit that button, and then you're just going to give it time to pick up the patient's oxygen saturation. I want to direct your attention back to this button because this button, while it's measuring, this button can be pressed to turn it upside down or turn it right side up. So depending on where you're standing, if you're standing behind it, you would press that button. If you're standing in front of it, you would press that button. You just want to make sure you're looking at it correctly because you could read this wrong if it is not correct. Also, if you look very closely, this says SpO2. I don't know if you can see that in the video, but down here it says pulse rate, PR, pulse rate. So you can see that the pulse oximetry, or SpO2, is 97%. It's measured by percent. And down here the pulse rate is 94. Okay, 95. And you can also see the pulse is actually pulsating as it's measuring the pulse. What's important to remember about this device is that it is electronic, and if it doesn't make sense, if the numbers don't, like let's say the pulse rate is ridiculously low or too high, and the patient doesn't look like they're in any distress, you need to question the accuracy of this device. Also, to measure the pulse oximetry, there's a light inside, and you can see the light sort of blinking. That light is actually measuring the color of the surface of the skin. Now that color would indicate how well you're getting oxygen to your finger. So if the patient's fingers are really cold, and sometimes if they have acrylic nails or nail polish that's really heavy, it may not measure. So again, as with any electronic device, if the numbers you're receiving are not normal, then you need to take it again. Pulse oximetry levels, normal levels would be above 93%, so 94, 95, 96, 97, 98, 99, 100%. Those are all normal. But if you get somebody who seems to be breathing just fine, they don't seem out of breath, and you get a pulse oxygen saturation percent of, let's say, 60, it could be that their fingers are too cold or that they have fingernail polish. Now, obviously, if it's 60 and they're out of breath and they look like they're going to pass out, then that's something you want to get the doctor involved with. Make sure to write these numbers down, and also remember that your pulse oximeter and your oxygen saturation rates have to be included in your vital signs. You'll actually be entering that number into your electronic health record, so please make sure to write that down and include that as part of your full set of vitals. Thank you.